Sarah adopted a stray dog. She named him Max. His behavior became more bizarre and violent every day. He would rub his nose and sniff her nose whenever he could. When she found out the real reason, she was shocked. Sarah was a dog lover. When she saw a German Shepherd mix wandering around her neighborhood, she felt that it was lost and hungry. The dog looked like a stray and had a cautious demeanor, indicating that it had been living on the streets for the past few days. Sarah approached the dog slowly without hesitation. The dog looked gentle despite its fierce appearance, so she decided to take it home and named it Max. At first, everything seemed to be going well. Max ate as if he hadn't eaten in weeks. He found a comfortable corner in Sarah's living room and slept through the night. For the first few days, Max seemed to be the perfect companion. He expressed his gratitude through gentle petting and seemed to understand that Sarah had saved him from the streets. Max followed her around the house, staying close but never demanding too much attention. Then something changed. Sarah noticed that Max was paying special attention to her face. At first, she thought this was normal behavior for a dog getting to know its new owner. Dogs explore the world through their sense of smell, and she thought Max was just getting used to her scent. His curiosity seemed nothing to be alarmed about. However, Max began to focus on a specific area of Sarah's face, her nose. The sniffing became an obsession. Max would stand directly in front of her and take deep breaths close to her nose, as if searching for something. The nighttime events were the most worrying. Sarah would wake up in the dark to find Max standing over her bed, his wet nose pressed to her face. Max would pat her nose faster and faster until she jolted awake. When she tried to push him away gently, Max would hiss in her throat. The sound made her body tremble. These nighttime encounters became a nightly occurrence. Max would wake Sarah several times, sometimes as many as 4 or 5 times a night. Each time, Max would behave the same way, patting, sniffing, and focusing solely on her nose. Sleep became more difficult, and Sarah found herself dreading bedtime. The quiet nights she had enjoyed in her first week with Max were now just a memory. During the day, Max would interrupt her meals, her work, and even her conversations with friends who came over. As soon as Max sensed an opportunity, Max would approach Sarah and start sniffing her nose. Sarah could not understand what was causing the dog to change. Sarah's family and friends began to express serious concerns about Max's unusual behavior. One day, her sister came to visit and saw Max's behavior with her own eyes. She watched in shock as Max tried to get close to Sarah's face, completely ignoring her commands to stop. Desperation over Max's behavior was unnerving. Her sister suggested that Max might be experiencing psychological stress from his time as a stray dog living on the streets, which could be affecting his mental state. The idea made sense to Sarah. She refused to think that the problem could be anything else. Sarah's mother thought that Max's increasingly aggressive behavior could be dangerous for Sarah, especially the growling when Sarah tried to interrupt his sniffing. She was especially distressed. Sarah's mother advised Sarah to take Max to an animal shelter before things got any worse. However, Sarah felt that she had saved Max from the streets and she was not ready to let him go. She believed that with time and proper care, she could help Max overcome his strange behavior. Hopefully, Sarah made an appointment with Dr. Rodriguez, a renowned veterinarian. She explained Max's behavior in detail, and Dr. Rodriguez agreed to treat him. Sarah was optimistic that a specialist might have a solution to Max's problem. On the day of the appointment, Max appeared calm as he drove to the clinic, not showing his usual restlessness. Sarah hoped that this was a good sign that the behavior might just be an occasional occurrence. In the examination room, Max was given a thorough physical examination by Dr. Rodriguez without resistance. The dog's temperature was normal, his reflexes were appropriate, and his overall physical condition was sound. He did not show any signs of disease or injury. That could explain its behavior. However, as soon as Dr. Rodriguez approached Sarah to discuss his findings, Max's behavior changed. The dog immediately resumed its old behavior, which was aggressive sniffing. Max tried to pull the leash to get closer to Sarah's face. Even though Sarah held on to the leash, the dog continued to sniff Sarah's nose wildly. Dr. Rodriguez observed this behavior with increasing confusion. Max showed no signs of aggression toward anyone in the clinic. The dog responded well to basic commands and appeared to be in good general health. Max's obsession seemed to be directed solely at Sarah. The veterinarian suggested that Max might be experiencing anxiety related to past experiences. He theorized that certain smells or situations might trigger memories of Max's time on the road. Dr. Rodriguez prescribed a mild anti-anxiety medication for Max. Sarah left the clinic feeling hopeful. She made an appointment with a dog trainer and started on medication as recommended by Dr. Rodriguez. They trained Max to follow commands, use behavior modification techniques, and worked with him to control his impulses and teach him to perform other behaviors when he felt the urge to sniff Sarah's face. Despite Max's best efforts, he was still obsessed with Sarah's nose. Anti-anxiety medication did not seem to have an effect on his behavior. The midnight behaviors became more frequent. Sarah found herself sleeping less and less, often only a few hours. The lack of sleep began to take its toll on Sarah's physical and mental health. She felt tired throughout the day. Her patience was waning, and she became irritated with her friends and family who did not understand why she would not let the problem dog go. During this stressful period, Sarah began to have health problems. She started to get occasional headaches, which she thought were a result of the lack of sleep. She also found her nose congested more often than usual. These symptoms seemed insignificant compared to Max's behavioral problems. Her friends and family pressured Sarah to stop caring for Max. Her sister visited regularly and saw that Sarah's condition was getting worse, and Max was getting more and more obsessed. One evening, her sister saw Max waking Sarah up 3 times within 2 hours, each time wanting to sniff her nose. 2 months later, Sarah's headaches became more frequent and her stuffy nose seemed to get worse. But she thought it was due to the constant stress of dealing with Max's behavior, so she put off seeing a doctor herself. Sarah's sister finally took matters into her own hands. She made an appointment with Dr. Martinez and insisted that Sarah see a doctor. Sarah reluctantly agreed, hoping that the symptoms she thought were stress-related would ease. But during the scan, Dr. Martinez noticed something concerning. Sarah's nasal passages showed signs of inflammation that seemed more serious than just a stuffy nose. The doctor immediately recommended a more thorough examination of her symptoms. The MRI scan changed everything. Dr. Martinez explained that the scan revealed a rare but malignant nasal tumor growing undetected in her sinuses. Sarah screamed in shock, but then she realized, to her shock, that Max had done nothing wrong. He was trying to save her life. Dogs can detect certain cancers through their excellent sense of smell, by identifying chemical changes before medical tests can be performed. Max went to great lengths to warn Sarah about a dangerous growth in her nasal cavity. With Max's constant warning, the tumor was discovered early enough for treatment to be performed. The stray dog she rescued has paid her back in an incredible way. What do you do if your pet starts behaving strangely? Do you trust its instincts or see it as a behavioral problem?